We are back answering your questions with Guilford County School Superintendent Dr. Sharon Contreras, Chief of Staff Dr. Nora Carr, and Guilford County Health Director Dr. Julia Van. All right, let me ask you this. What point do numbers have to be before schools can restart? Dr. Van, they're asking, why is 5% better than 6%?
Sure, thank you for that question, and it's really a good question because all of these numbers are something that we use as guidelines. They're not necessarily set in stone. They're just indicators for us to be able to tell what the community spread is. Using the guidance that we're getting from the CDC and that we've been looking at all along, there are different categories in that transmission rate, lower risk, moderate risk, higher risk of transmission. And we want to be in that yellow category of transmission, which in terms means a positivity rate of about 5%. In order to feel comfortable that together with the other mitigation strategies and the number of new cases, we will have a moderate risk of transmission in the schools. The number that we're looking at or that we're hoping to get in the next few months is as low as possible in that percentage. So less than 5, less than 3, less than 1% is going to be ideal, but we know that in order for the kids to go back to school, we need to bring that risk of transmission to at least a moderate place.
Okay, this next text question from a parent says, my child has been attending kindergarten from 9 to 12 every day. What's the difference between going to school for 3 hours and not all day?
That's another great question. As you know, that program started voluntarily, and we had hoped by this point to have all students back in school for a full day. However, we're not at that point yet, and we still have about 35 to 40% of our kindergartners still at home. As I mentioned earlier, we do not have a second set of teachers. So we need to make sure we have teachers who in the afternoon can provide instruction to the students who are still at home. So we cannot have a full day program and not provide an educational program for students who did not choose to come in.
Mm-hmm. So this is a point of contention. Just we're going to go to school and then all of a sudden we're not going to go to school. Makes it very difficult for parents. Is there any talk about having discussions beforehand and calling something off sooner the next time?
Well, we did say we are going to let parents know on Friday about Monday, but this will also happen once school begins. And we have cases of COVID. That's one of the reasons we've gone to the one-to-one device initiative, because we are going to have cases of COVID over the next 18 months. And we're going to have to be able to be used to saying schools are closed tomorrow for deep cleaning and know that students will be home, or there will be classrooms that are quarantined, or wings of a building that are quarantined for 14 days, and students and staff will be home during that period. This is a new world for schools, and parents are going to have to get accustomed to this.
One parent has already asked, should we just scrap the fall semester and just go back in January?
There are some parents who feel that way. There are some board members that feel that way. I don't think so. I think that, again, the learning loss is too great. The mental health issues we're seeing in this country are significant, and that if we can get students back to school, we should try to do so as soon as it is safe to get them back.
Okay, and so again, Friday is the next time that all of you will be meeting together, looking at those metrics to find out what's going to happen for Monday.
Correct.
Okay, Dr. Van, thank you very much. Dr. Contreras, Dr. Carr, thank you very much. We thank you for your text questions as well.